I'm Matthew Kearns, a registered nurse, and this is my week 5 head-to-toe assessment for Ohio Christian University. This is my patient, Amanda Kearns, a consenting adult over the age of 18 who signed a consent form. Like I said, I'm going to be doing a head-to-toe assessment. So I'd start, wash my hands, come in the room, introduce myself. Hi, my name's Matthew Kearns. I'm going to be your nurse today. And I'm going to do a head-to-toe assessment, if that's okay. So I'm going to ask you a few questions. Can you tell me your name and day of birth?
Amanda Kearns, 9/15/1980.
Amanda, can you tell me where you are currently?
Williamsport, Ohio.
Can you tell me about what time of day it is?
Evening time?
Amanda, do you have any breathing problems or heart problems?
No.
Are you having any difficulty breathing now?
No.
Are you having any chest pain or any pain at all?
No.
Any problems with your bowels or bladder?
No.
Any problems anywhere that you want to mention
No.
before we get started? Okay, so first off, I'm going to start by inspecting your head and neck. I'm going to look for any moles, lesions, scars. Do note a couple moles. You want to look at regularity, make sure that they don't have a bunch of irregular areas, that they're not darkened or changing colors. If they are, you want to follow up with a family physician on that. Next, I'm going to look at the head and scalp. Some drier areas back here. A couple moles, nothing looks irregular. I don't feel the hair, it looks healthy and clean, good hygiene. I don't feel around for any tenderness. Tell me if you feel any tenderness.
No.
No? Okay. I'm just going to look at your ears. Can you pull your hair back? I want to make sure your ears are symmetrical. Can you smile for me? Stick out your tongue. Open. Okay. Okay, that's good. And I'm going to continue with the face and head. So I'm going to just palpate on your sinuses. Tell me if you feel any tenderness there. No? I'm going to palpate your lymph nodes. Start with the occipital. Move down to cervical down here. Submandibular. Subclavicular. And this middle. Trachea midline. Thyroid's not swollen. No jugular vein distension. For the eyes, I would use an ophthalmoscope if I had one, but I don't currently have one. So I'm just going to use a pen light. Can you look forward for me? Just look straight ahead. I'm going to test your peripheral vision. Can you see this over here? Just look straight.
Yes. Yes.
Watch it. Okay, follow it with your eyes. Take a piece of paper and cover one of your eyes. Just look straight ahead. Okay. Pupils are equal, round, reactive to light, accommodating. Again, if I had an ophthalmoscope, I could look at her retina, disc, and cups. Also would use an otoscope to check out the ears. I would palpate them first, make sure there's no tenderness. Then I can use an otoscope to look in the ears, make sure they look okay. Also with the nose, I could also use an otoscope to examine the nose, look at the septum. Do you have a deviated septum? Okay, then take one finger and press it on your right ear. Okay, now breathe in, breathe out. Do the same thing for the opposite side. Okay. Any difficulty breathing with either one?
No.
Okay, good. Let's look at the mouth. Lips look good color. Mute this up. Open your mouth. Say ah.
Ah.
Because it's moist and pink. That's good. Teeth are all there. Do you have dentures or regular teeth?
Regular teeth.
Good. Gums look good, not bleeding or anything. So move on and finish looking at the neck. Can you turn against my hand? Turn against my hand again. Okay. Neck looks to be symmetrical, in line, like I said. Next, we're going to move down to. We're going to go ahead and look at your chest expansion. Just breathe normal. We're going to look at chest rise and fall. Want to make sure there's no barrel chesting, no use of accessory muscles. That's very important. She looks to be breathing normal. It's symmetrical. So we would move into doing some tactical fremitus. I'm just every time I press down, I want you to say 99. Okay?
Okay. 99.
And you feel the vibration through your
99.
chest.
99. 99. 99. 99.
It's good to do posterior and anterior. So you'll move to the front and do the same thing. Next we would, if you want to slam the end, it might be easier. Right there, it's fine. We want to percuss in all fields and listen for resonant to dullness. On posterior, we also want to percuss the CVA with your hand, fist lightly over your hand. And again, do anterior. Okay, so you can sit around like right on this corner. Okay. So next we're ready to auscultate the lungs. We'll start with posterior again. You want to listen to a full inspiration, expiration. Make sure there's no wheezing, crackles, bronchi. And do the same thing anterior. Now, while we're auscultating, we'll go ahead and listen to your S1, S2 of your heart. Listen over the apical for up to a full minute. Normal S1, S2. You don't have any history of heart murmurs or anything, right? I didn't hear any.
No.
Okay, so that's good. If you want to just relax for a minute, we'll go ahead and take a look at your abdomen. So for abdomen, if you just want to lay back for a second, it's a little more. If we have a little bit more discrete area, we could do a better inspection of the whole body with a gown on. And once she's in this position, I just want to go ahead and inspect the whole body. Notice any moles, scars, lesions, any surgery marks or anything like that. And like I said, if she was in a gown in a discrete environment, it'll be a little bit better. So for the abdomen, first we want to inspect it. Again, looking for the same stuff, moles, lesions, scarring. Looks okay. We want to auscultate before we percuss and palpate. So, listen to all four quadrants. Now, listen to her aortic and renal arteries. Big thing with auscultation, we'll make sure that she can have hyperactive or hypoactive bowel sounds as well. But if you don't hear anything, we'll listen up to a full 5 minutes before you call anything absent. Because that's very important. So, next, we're going to go ahead and percuss the abdomen. It's good to, you want to go over areas like the liver, the kidneys, the spleen, and make sure you hear all those. Next we're on palpate. Make sure there's no tenderness anywhere. Any tenderness noted?
No.
You feel the kidneys. That's good. This is also a good time while you're here, if it was a discrete location, you could go into a pelvic exam and talk about the importance of prostate exams for men or pap smears for women. And women over 21 should have a pap smear like every 3 years to check for cervical abnormalities in this case. So you'd inspect the pelvical area, make sure hair's there or not there, and make sure it's clean. Everything's intact, no discharges, no bruising, scars, no umbilical problems, things like that. So if you want to sit back up for me. So we're just going to take if you want to stand up again, we're just going to go ahead and do a little bit of musculoskeletal stuff. Just going to look over the body, make sure you're symmetrical, shoulders are in line, hips, if you want to turn this way for me, just want to lean forward, check the spine curvature, lean backwards, spine straight, okay. While we're here, we're going to do a neuro test too. We're going to test Romberg's test. Can you close your eyes for me? Just stand there. And make sure your patient doesn't fall over. It's a neuro test. Positive sign would be them falling. So, okay, you won't eyes, so she is negative. Just take a few steps forward, heel to toe. Okay. Now walk back on your tippy toes. And walk forward on your heels. Okay, we're going to do some range of motion. If you just want to turn towards me. Put your arms up above your head. Like this. Okay, put your arms behind your back. Put your arms straight out. Okay. Turn them over. Flex your arm in. Flex them out. Okay, now hold them straight out like this. Turn them over. Turn back. Flip your wrist up. Flip them down. Spread your fingers apart. Back in. Good. And while we're here, we can go ahead and test capillary refill too. She has her hands out. Less than 3 seconds is excellent. Also, we'll do some hand grasp. Push. Pull towards you. While I'm doing this, I like to feel pulses too while I'm right in this position. Okay, good. So you want to have a seat then, and we'll lay back down, and we'll do some more musculoskeletal. If you want to bend your left leg up, your chest, and down, right leg up, and down, that's good. Push towards me, pull towards you. Again, I like to test pulses on here, prosophius, patella. Make sure there's no swelling or edema. I look for trace edema too. Good. No swelling. That's excellent. If you want to go ahead and sit back up. So I think we've covered most of the head to toe. This is also a good time. You can do a breast exam, and this is a good time to talk about breast self-exams or testicular exams for males, and how it's important to do those monthly. Women don't usually have mammograms till starting at age 40 to look for abnormal growth or changes in the breast tissue. But with the breast exam, you want to start at the nipple, work your way around, feel for any lumps or tenderness or any changes. You want to check clear over into the lymph nodes. Now, if I was doing it, I could have you change into like 4 different positions to elicit different responses to make sure we don't miss any areas. It's very important to do this yourself, though, and if you notice any changes, to follow up with your family physician. So patient muscles were developed without atrophy or hypertrophy. Arms and legs were symmetrical. No edema was noted. She's alert and oriented, ×3. Joints weren't tender. No swelling. Has full range of motion. Good muscle tone and strength. Spine was symmetrical. Without deformities or tenderness. And I believe that completes our head-to-toe assessment. Thank you.